be able to visualize the screen now on YouTube as well. And this meeting is going to be staying on YouTube for the rest of its life. So just in case any one of you wants to access this entire thing again, you can see it again on YouTube as many times as you want to do that. All right. So that is just something which I wanted to be clear about when I'm going live on YouTube. All right. So let me just verify and confirm that. And that seems to be confirmed. So yes, once again, wants to access, welcome to each and every person who is on YouTube live as well. And let's start this entire chapter. In order to start this entire chapter, I'm going to be doing the screen sharing. So I'm going to be sharing my screen with all of you, and I'm going to try and draw this entire thing for you so that you understand how are you supposed to correlate things with white discharge. Okay, so I believe the screen is now visible to everyone. Okay, so let me just start. And today's topic is going to be on white discharge. All right. Now, what is important for all of you to understand as far as white discharge is concerned is this entire thing. See, I'm going to try and draw out the entire anatomy. Okay. So when I draw the anatomy, this is what you are supposed to look at. This is the vagina. And above the vagina is going to be the uterus. All right. The uterus, as you are all aware of, okay, as all of you are aware of, the uterus is going to be consisting of obviously the body of the uterus, okay, which is also called as the fundus. That's the lower segment. And then you have this portion called as the cervix. Underneath the cervix is the vagina, okay, and vagina is the natural orifice which is open to the outside. So what is important to understand is that in the cervix, there is something called as the endocervix, which is the cervical canal. See, I'll try and draw it in red color. See this? This is the canal. This is the cervical canal. Okay. What is important to understand about this cervical canal is that this cervical canal has glands, which are called as endocervical glands. Okay. And see this, these endocervical glands consistently produce the discharge. Okay. These glands keep on producing the endocervical discharge. Now, the commonest thing which they produce is the mucus. And remember, mucus plug, which is produced by the cervix, has a lot of functions. Huh? It has reproductive functions, and in pregnancy, it has protective functions of early pregnancy. Okay. So these are the two very important things which are being produced. But as we all know that the uterus is actually dependent on the ovary. So the type of discharge, this type of discharge, it changes based on menstrual cycle. Okay, this changes based on the menstrual cycle. It is important to remember that usually in early menses, okay, that means just after menses and just before menses, in both these situations, women can experience increase in discharge. Okay, and one must also remember that especially during ovulation, this is a very important thing to remember, especially during ovulation, the amount of discharge can go up and it can also become slightly sticky. This is important for people to remember. Okay. Remember, a lady can normally have approximately sort of 1 spoon a day. If I just look at the amount of discharge, it can be 1 spoon a day, which can correlate to approximately 2 grams to 3 grams per day. So for a lady, it is actually normal to have physiological white discharge. Okay, this is what is called as physiological white discharge. This is considered to be absolutely normal. Simultaneously, if I look at the part below that, there is the vagina. And remember, the vagina has a lot of venous complexes around it. Huh? So the vagina has a lot of veins surrounding the vagina. All these perforator veins are surrounding the vagina. Apart from this, vagina also has 2 or 3 glands, which are called as Skinny's glands. Okay. These are the lubricating glands of the vagina. So I will just name them as Skinny's glands. Okay. And most of the discharge which occurs in the vagina or which occurs through the vagina, and that is important to remember, is actually going to be a transudate. Okay, it's going to be a transudate. So if you study the vagina is actually lined by, you know, epithelium. And this epithelium, so all the venous heaviness which is there, it then gets transudated and it comes out as vaginal discharge. The other important thing which I want to mention here and which everyone must remember, let me just draw the vagina again. See, normally the vagina is acidic. Okay, if I look at the venous complexes here on both the sides. Now, normally the pH, let me just go to blue color again. The pH of the vagina is going to be less than 4.5. It is an acidic medium. You know why it is acidic? Because on the vagina, there are presence of bacteria. And this bacteria is something called as lactobacillus. That means it is lactic acid bacteria. So acid itself means it is generating acid. So what does it do? It starts using glycogen. Glycogen is a common energy source which is available. And under the influence of glycogen, the lactobacillus thrives in the vagina. So now you will be wondering, is this lactobacillus healthy or unhealthy? Remember, lactobacillus is the healthy vaginal flora. Okay, it is absolutely normal to have lactobacillus. So it is healthy vaginal flora. Okay. So what does this vaginal discharge actually constitute of? Okay. This vaginal discharge, when we talk of in any lady, if a lady is having normal vaginal discharge, and if we talk of the vaginal discharge, it normally consists of cervical fluid, which we spoke of. You're right, endocervix. So that means inside the cervical canal, it consists of the bacteria. That is very important for you to understand. It consists of the bacteria. Which bacteria? Lactobacillus. That's common. Okay. It also has dead cells. All the squamous cells of the vagina. See, this entire lining can be shed off, and this entire cells. Okay. This entire cells are shed off as a part of the vaginal discharge. So these three are the main constituents. As we discussed, there are certain factors which can increase or decrease the vaginal discharge. And one of the important factors which you should remember, which increases the vaginal discharge. Remember, as I said, it is a transudate. Okay, so I'm here just explaining what happens. So transudate means if there is more blood flowing, there will be more discharge. So what causes more blood to flow? It is simple. One, infection. Two, sexual activity. See, inside, whenever somebody is having sexual activity, there is a lot of blood which is flowing. Okay, so that can increase the transudate. Third, pregnancy. Common things. And fourth, loss of normal flora. Why does this happen? Now, normal flora can be lost in cases of heavy antibiotics. It can be lost in cases of stress, and it can be lost due to unknown factors, and it can be also lost due to poor hygiene. So the most important thing in our country, actually, if you look, is actually going to be poor hygiene. The second most important factor which causes increased vaginal discharge in our country, let me put that in green color for all of you. So the number one factor is going to be poor hygiene. The number two factor is going to be pregnancy. Number three factor is going to be infection. In our country, these things cause an increased discharge, but you must remember that whenever there is increased discharge due to pathological conditions like infection, it is also going to be accompanied with foul smell, and it will have a change in color. This is very important for you to understand. It can be accompanied with foul smell, and it can have change in color. Okay, see, whenever I talk of this entire topic and whenever I try to describe the white discharge, in this brief 1 minute, you must all again understand this concept very importantly, that the vaginal discharge is contributed by the cervical canal, which is present here, and from the transudate which is occurring in the vagina. Okay, having a normal physiological discharge is absolutely normal. That means if you have a discharge of around 2 to 3 grams per day, it is considered to be normal. It can just It can just moisten up the panty liner. That is something which is normal. Another important thing which family physicians should remember is that these changes are actually based on the menstrual cycle. And it is the period of ovulation where the vaginal discharge can become sticky. That is something which is very important for all of you to remember. Apart from this, you should remember that the normal pH of vagina is going to be an acidic pH, which is going to be constituted by a huge number of lactobacillus, which is going to be the normal flora of the vagina. Any condition which causes a change in these parameters, any condition which causes increase in the transudative activity, that means increase in the blood flow to the vagina, can cause increased white discharge through the vagina. The most common condition being poor hygiene, the second common condition being pregnancy, the third most common condition being infections. These three are very, very important. And apart from that, as I mentioned, antibiotic exposure, stress, unknown factors, all of them cause destruction of the lactobacillus, thereby disturbing the healthy vaginal flora and thereby causing an increased vaginal discharge. In a normal patient, the vaginal discharge is going to be constituted of the cervical fluid. It is going to be constituted of the lactobacillus, and it is going to have dead cells which are actually getting thrown out from the vagina. This is normal. Now, if I switch back and if I stop home, all of you, and I would like to tell you that remember, for any family physician to understand the vaginal discharge, the most important thing that you should understand is this discharge a physiological discharge or a non-physiological discharge? That is the most important thing. In order to understand what is a physiological discharge, you will have to understand how does that discharge come and where does that discharge come from. I hope this short 15-minute lecture serves a very important purpose in helping you understand what is the constitution of the vaginal discharge. In our next Monday session, we are going to try and understand about pathological white discharge. Once we understand the physiological discharge and once we understand the pathological discharge, that is when in the session after that, we will be talking about the treatment